Hello friends, today I am going to show you facial nerve in a CT scan bone window. So this is a close-up of left petrous bone and left mastoidea cells and left ear area. So before we start looking at the facial nerve, let me orient you exactly where we are. So this bit here is the internal auditory meatus, and the bit down here is the cochlea. So as we all know, facial nerve enters through the internal auditory meatus and then passes through the facial canal and finally exiting through stylomastoid foramen. So to see the facial nerve in facial canal, we have to go superior to the cochlea. So let's go a little bit superior, and now if you can see from this internal auditory canal, you can see this black thing coming out, which is actually the facial nerve going anteriorly. And once this facial nerve goes anteriorly, somewhere around here, it forms geniculate ganglion, and after making the geniculate ganglion, it gives off superficial greater petrosal nerve here, and after giving superficial great petrosal nerve, it will travel back within the temporal bone. So if we go, so this is here, it is reaching, and now if I can convince you, just follow this black line here which is coming backwards, and so this is the lateral semicircular canal. Facial nerve will pass just next to the semicircular canal, and this is the facial nerve going within the facial canal, and we can keep following this thing. This is the facial canal containing facial nerve. We are still following this thing, and if we go down, this is now we are almost reaching stylomastoid foramen, and just before exiting through stylomastoid foramen, it gives off chorda tympani branch, which will take the taste sensation from anterior 2/3 of tongue. And if we move further downwards, now you can see this is the stylomastoid foramen, and facial nerve will exit through this and then go into the parotid somewhere here, and then divide into 5 branches to supply the facial muscles. So this was the overall course of facial nerve. If I show you, this is the internal auditory canal, and this is the cochlea. So if we move superior to cochlea, we can see this facial nerve going, making a geniculate ganglion here, turning backwards, coming down. This is the facial nerve, and exiting through stylomastoid foramen.